So what are the side effects of treatment for prostate cancer? There are three major side effects of treatment. One is to do with the urinary control, one is to do with sexual issues, and the last one is to do with bowel issues. Let me take one at a time. The first one, let's talk about urinary control issues. Urinary control problems means that you can't control the water and you may require a pad in your underwear to stop embarrassing leakages. This is called incontinence. Incontinence can be mild, moderate or severe. The most common reason for urinary incontinence is after surgery or what we call radical prostatectomy. And the reason for it is because the urinary sphincter muscle, the muscle that controls leakage, is bruised or temporarily injured. And that's the reason why most people who have urinary control issues get better. In fact, in very good hands, up to 99% of people recover excellent urinary control after surgery by experienced surgeons. The reason why some people develop temporary urinary incontinence, and this may last for as short as a few days, but could last as long as 6 months, is because the nerves and muscles involved in urinary control can be temporarily injured. Fortunately, they generally recover. Important that you understand that pelvic floor exercises commenced before your surgery can improve the speed of the recovery of those muscles. It's easy to get those muscle exercises wrong, so it's quite useful to use DVDs or sometimes even a pelvic floor physiotherapist to do them correctly. When you are recovering from incontinence, and not everybody gets it, I've been pleasantly surprised by the fact that 80% of my patients actually don't get any incontinence at all. But that still leaves 20% of people who do have temporary incontinence. For those people, the understanding of the use of pads is critical. What size pads? Where do we buy them from? How expensive are they? How often do you change them? Will I leak through them? All those questions need to be answered, and companies such as Bright Sky can help you decide what type of pad and can minimise the impact of the cost to ensure that during this temporary period of incontinence you're not embarrassed and you can continue to act socially as you would like to do. Always remember that if all else is not working during this early phase, it's important to gather your other part of your team, the pelvic floor physiotherapist, to personally teach you how to do this technique to speed up the recovery of the pelvic floor, getting rid of that incontinence as quickly as possible. Sometimes the incontinence is due to silly things, such as drinking too much, drinking alcohol, drinking too much coffee. All these type of things can actually make incontinence worse. So during this temporary incontinence period, it's important not to overdrink, to make sure you don't have a simple infection, to ensure that you don't take too much coffee or caffeine, and to ensure that you don't drink too much alcohol, at least for this short period of time.